بسم الله الرحمن الرحيم. النهارده ميعادنا مع كيس كويز نمبر 15. Case data: 35 years old woman. History: she had 6 months history of worsening fatigue, 3 weeks history of progressive shortness of breath, and 2 weeks history of orthopnea and leg edema. Patient is known to have diffuse cutaneous systemic sclerosis for years. دي حاجة غير اللي امبارح يا جماعة، مش هي نفسها يعني. GIT show GERD treated by omeprazole only. Physical examination: the patient is alert, respiratory distress, temperature is 37.2 تعتبر normal, blood pressure 106/74 يعني طبيعي برضو, pulse rate 108 108 ودي عالية قوي طبعا, respiratory rate 24 برضو عالية. العيانة فيها شورتن اوبريس, عندها ديسنيا وعندها تاكيكارديا. بودي ماس اندكس 31 اوبيس شوية. oxygen saturation 92%. elevated jugular venous pressure, crackles at lung bases. Skin examination show diffuse systemic sclerosis, skin thickening on the face and 4 extremities beyond elbows and knees, sclerodactyly, lower limb edema till the knees. Laboratory investigations show serum creatinine 2.2 عالي طبعا. Cardiopulmonary investigations show chest X-ray, bilateral pleural effusions and diffuse alveolar infiltrate. Echo generalized myocardial hypokinesia and left ventricular ejection fraction of only 20%. ECG non-specific T-wave changes. الحكاية دي فيها حاجة مش مظبوطة في الهارت برضو, فيا ترى ممكن تكون ايه؟ So, which of the following is the most likely cause of this patient clinical presentation? هل دي cardiomyopathy complicating scleroderma, ولا constrictive pericarditis, ولا pulmonary arterial hypertension, ولا scleroderma renal crisis؟ تفتكروا مين فيهم هي الصح؟ طبعا امبارح واول امبارح احنا كانت الاجابه رقم دي, ففي ناس ممكن تعمل اذكياء وتجيب رقم دي برضو, تقول لك هو كل مره بيجيب الاخرانيه. بالمناسبه صح, كنت قريت بحث يعني كان مضحك شويه, بيقول لك كيف تجتاز امتحان MCQ من غير ما تكون مذاكره. فقال لك ان 40% من الاجابات بتبقى الاجابه الاخيره هي الصح, مش 25%, يعني بتبقى 40% اكتر شويه من التوزيع الطبيعي بتاع الاسئله. قال لك ان الممتحن عاده او وضع الاسئله بيميل نفسيا ان يحط الاجابه الصح في الاخر, وقال لك لو الاجابه الصح all of the above يبقى غالبا 70% هي الصح مش 40. يعني ده كلام يعني طبعا مبني احصائيا, اوعى حد يعمله يا جماعه هتسقطوا. ماشي, خلينا مع الحلقه بتاعتنا. يا ترى الاجابه ايه؟ The answer is not D, the answer is cardiomyopathy. The educational objective of this case is to diagnose cardiomyopathy in a patient with systemic sclerosis. العيان اللي عنده systemic sclerosis وخصوصا لو diffuse ممكن أشخص cardiomyopathy لو لقيت عنده أعراض شبه الست دي. The most likely diagnosis is cardiomyopathy in this patient with systemic sclerosis because cardiomyopathy due to systemic sclerosis induced coronary vasospasm and microvascular disease leading to patchy myocardial fibrosis is the most common symptomatic manifestation of heart involvement in systemic sclerosis. Although accelerated macroscopic coronary atherosclerosis has been associated with other autoimmune inflammatory disease, coronary vascular involvement in systemic sclerosis is most often microvascular with ischemia due to structural changes and recurrent spasm of small vessels. This results in contraction band necrosis, a pathological findings due to episodes of myocardial ischemia followed by reperfusion. This process may ultimately lead to patchy fibrosis resulting in cardiomyopathy and heart failure. Patients who have systemic sclerosis with symptomatic cardiac involvement have a poor prognosis and a mortality rate of 75% at 5 years، يعني ربعهم بس اللي هيفضل عايش لمدة 5 سنين من تاريخ تشخيص الكارديوميوباثي. This patient presents with evidence of fluid overload due to heart failure as seen on her physical examination and confirmed by abnormal chest radiographs and an electrocardiogram suggesting diffuse myocardial dysfunction consistent with this cause. Infiltrative myocardial fibrosis and conduction abnormalities may also contribute to the cardiac dysfunction but are less common causes of systemic sclerosis heart disease. Constrictive pericarditis is a chronic disorder resulting from inflammation and fibrosis of the pericardium with loss of elasticity and resulting in non-compliance of the pericardium. Although it may be associated with connective tissue diseases, this patient doesn't have specific clinical findings typically associated with constrictive pericarditis, such as a pericardial knock or pulses paradoxus. Furthermore, her echocardiogram show evidence of diffuse myocardial dysfunction and no evidence of impaired cardiac filling with normal ventricular function as would be expected with constrictive pericarditis. Pulmonary arterial hypertension is a common complication of systemic sclerosis and may lead to copulmonal and primary right-sided heart failure. This patient's clinical presentation is more consistent with generalized myocardial dysfunction rather than right-sided heart failure. So the most commonly diagnosis for this case تحديدا هو الكارديوميوباثي. The kidneys are frequently involved in systemic sclerosis with scleroderma renal crisis occurring in 10 to 15% of patients خصوصا لو كانت diffuse طبعا زي حالتنا. Scleroderma renal crisis causes acute onset oliguric kidney disease, severe hypertension, and often microangiopathic hemolysis and thrombocytopenia. Except for evidence of impaired kidney function likely due to heart failure, this patient clinical presentation is not consistent with scleroderma renal crisis. هنا ما عندناش حاجة من الكدني خالص غير ارتفاع الكرياتينين، وده ممكن يفسر بانه due to heart failure، لكن مش ماشية خالص انها تبقى scleroderma renal crisis. The key points here is microvascular cardiomyopathy is the most common symptomatic manifestation of heart involvement in systemic sclerosis and presents with heart failure and very poor prognosis للأسف الشديد. And finally, thank you very much for your attendance. ونلتقي بإذن الله غدا في Case Quiz number 16. والسلام عليكم ورحمة الله وبركاته.